All right, ladies, so part 2 of my low testosterone in women series. So in the last video, we talked about signs and symptoms of the low testosterone. Today, though, we are gonna dive into how you get diagnosed, how can you test for it, what am I looking at, why is this happening, what could be causing it, okay? So if you suspect low testosterone, the easiest way to know is through a blood test, or through your GP or your gynecologist. More typically, so it would be your gynecologist. So if those symptoms we talked about in the last video, if you have the low energy, the increasing belly fat, the low libido, all the things, going and talking to your gynecologist that you're experiencing all of these symptoms and you're curious to find out if a low testosterone is contributing to them, getting a prescription for a blood test through your doctor will suffice, okay? So getting this blood test, it's going to give us the levels. Your testosterone levels don't fluctuate as much as your progesterone and your estrogen, so it doesn't necessarily matter what day of the month you get it done as well. But like I said, gynecologist, get that blood test, but there's a couple things, couple caveats to that, I would say, okay? So issues with testing this way. First, you wanna make sure that you get a full hormone panel, okay? So make sure that your doctor doesn't just send you for testosterone and that's it, okay? So you wanna make sure you get full sex hormones, so the progesterone, the estrogen, the testosterone, the metabolites of these things as well, if you can, as well as a full thyroid panel, because these sex hormones and the thyroid they work very closely together, okay? So a lot of times when people are having issues with hormone imbalance and hormone levels, sometimes it's not necessarily the amount of the hormone that you have or don't have. Sometimes it's the ratio and the proportion and how it is measuring up with the other one. So just a small example, something like estrogen dominance, if your estrogen is through the roof, okay, if the number's really high, yes, that makes sense. But some people have estrogen dominance because their estrogen is just kind of normal, but all of their other hormones are very, very low. So that is considered estrogen dominance, okay? So that is a key factor when you're asking for this testing from your doctor. Make sure you're getting the full picture, you're getting the full panel, and also try to ask for that full thyroid panel as well, okay? So the second caveat or second issue is that in the conventional medical system, and many of our physicians, our GPs and our gynecologists, when they test these hormones for us, they are going to look at the conventional normal level, which would be considered 50 to 70. That would be a typical range, okay? But a lot of people, when they have a level of, say, 15, which would be considered normal, they're going to experience a lot of symptoms. Somebody else might have 15 and they have 0 symptoms of low testosterone. Okay, great. But if you're experiencing a ton of symptoms and your levels are pretty darn low, that's where the functional medicine world comes in, looking at optimal levels. So your optimal levels are going to be geared towards feeling your best self, feeling strong, like a strong libido, good energy, all of those things. And we're gonna look at that level to be more close to 30 to 50 to be optimal and feeling fantastic, okay? So there are some discrepancies. If you are able to get the test and then you get the results, often, even though you have all of the symptoms, a physician might explain that your levels are normal, but I encourage you to dig deeper than that, okay? The third little issue is often, I've run into this with so many clients, referring them to their physician to ask for testing. A lot of times you are going to run into physicians that are not willing to entertain any hormone testing or any treatment for issues with hormones. Okay, there's a lot of, in the medical world, a lot of old science and data and things that are very overwhelming, but a lot of physicians do not want to entertain the idea of looking into your hormones and possibly treating them. And again, that's where functional medicine comes in, where we're looking to get you feeling your best self. The conventional medicine world is gonna just chalk it up to getting older, but that's not me. That's not the functional medicine world. We are going to dive into getting to the root cause and getting you feeling your best self. So little side note, my new credentials as an integrative and functional nutrition practitioner, fast forward into 2025, I myself will be running functional medicine hormone panels and be able to advise and treat via nutrition and supplementation to help you get your hormone levels optimal. So stay tuned for that. Okay, so moving forward from that, what can cause this? Okay, so those are all the concerns, right, with getting the test and things like that, getting the blood test, and understanding. Oh, side note, there are also other functional medicine ways of treating: saliva, dried urine, doing it 4 times in a day to get a whole view of what a 24-hour period looks like, to really see the fluctuations in a whole day. There are much deeper ways to test aside from just blood. So if you're not getting the answers, if the tests aren't making sense, but you're having all the symptoms, I encourage you to keep digging deeper. Okay, now going back to the cause of the low testosterone. So what could the true root be? Age, of course, is a factor, but just because you're getting older doesn't necessarily mean you just have to feel like crap every day. So age and menopause, testosterone is naturally going to slightly decrease as we age, and during menopause, your hormones are going to be all over the place. So that could be just the root cause. It's just that we're starting to get older. Number 2, chronic stress and adrenal health. I cannot tell you how much this impacts everything that could be going on hormonally with you. So constant stress is going to keep your cortisol high, which in turn is going to lower your testosterone. Okay, so you could have high levels of cortisol causing that belly fat, as well as a decrease in testosterone also causing that belly fat, and then that would make sense why that weight just won't come off. Medications, certain medications like birth control pills or long-term steroid use, a lot of different medications out there can drastically affect your hormones, including your testosterone. And of course, lifestyle factors. So lack of exercise, poor diet, not enough sleep, all those things contribute to lower levels. That's where our balanced community comes in, right? Trying to battle all the lifestyle factors that could contribute to these poor health. We're trying to exercise, we're trying to watch our diet, eat anti-inflammatory, and focus on that 7+ hours of sleep, right? With our balance trackers. So really hone in on those as well if you suspect that your testosterone could be low. Okay, so it's important to remember that low testosterone, it can be diagnosed with proper testing, and understanding the keys, like understanding this is the key to finding the best treatment for you. So in the last video, I'm going to dive into, so okay, you got the blood test or you did the dried urine functional analysis, your levels are low normal, but you have all the symptoms. Now what the heck am I going to do with this information? So in the last video, we're going to dive into treatment options so that you can start feeling your very best again. Okay, so be sure to watch part 3 for more information on how to balance those hormones, and I'll see you guys next week. Reach out if you have any questions. Bye.